Well, thanks for having me, Isabel. It's so interesting. I love listening to patients and caregivers talk. And, like what Kim said, everyone knows what cancer is. Everyone knows what breast cancer is, and everyone knows that you need to get a mammogram to screen for breast cancer. But very few people know what PAD is, and very few people know about all the modifiable risk factors that exist to either halt or limit the progression of PAD. And so I think that was my biggest goal when we started this kind of initiative, was to get out into the communities that were underserved and were socioeconomically disadvantaged, who didn't have the access to care. And I think, even for people like Kim, who doesn't necessarily have PAD, but knows someone who does, maybe a person would come to one of these screening events while they don't have PAD, they might know someone who does. And I think that's where the education piece really comes into play, being able to educate the community so they can potentially take this information back to a family member or a friend. And they're like, oh, maybe they're at risk for PAD and I should talk to them about it.